Have you ever felt that familiar ache or discomfort that just wears you down? You know, the kind that makes simple tasks feel monumental and steals your energy? While we all experience pain sometimes, imagine facing the end of your life with constant, uncontrolled pain. This isn't just a physical sensation. It's a profound assault on a person's dignity, peace, and ability to connect with loved ones in their final moments. Effective pain management at the end of life is a crucial, yet often misunderstood, aspect of palliative and hospice care. It's not about prolonging life, but about ensuring the time that remains is lived with the greatest possible comfort and quality. Many people, including patients and families, mistakenly believe severe pain is an inevitable part of the dying process or fear that pain medication will hasten death. This misunderstanding, or sometimes a reluctance to openly discuss pain, can lead to needless suffering. You might think that when someone is nearing the end, pain is just something they have to endure. But the truth is, with the right approach and understanding, the vast majority of pain at the end of life can be effectively managed. It doesn't have to take away their ability to communicate, to feel a loving touch, or to experience moments of peace. It doesn't have to steal those precious final interactions. In this video, we're going to explore 6 simple, yet vital, things everyone needs to know about effective pain management for patients in their final stages. We'll uncover how focusing on comfort can make a world of difference, not only for the patient, but for the entire family. Before we dive deep into these crucial points, if the comfort and dignity of those nearing the end of life is a topic that resonates with you, please take a moment to hit the like button right now. Your engagement helps us reach more people with this important message. And don't forget to subscribe to the channel and turn on notifications so you won't miss our future videos offering insights and support on difficult health topics. Let us know you're here with us by commenting care below. All right, let's start with the point 1, understanding that pain can be effectively managed. The first crucial point is simple. Pain at the end of life can and should be effectively managed. It is not an unavoidable fate. This isn't just wishful thinking. It's based on decades of advancements in palliative care medicine. The goal shifts from curing disease to maximizing comfort and quality of remaining life. Healthcare professionals specializing in palliative care have the knowledge and tools to assess pain accurately and create a management plan tailored to the individual's needs. They understand different types of pain and how to address them without causing undue side effects or discomfort. Consider the experience of one family I know. Their mother was in her final weeks, and they were told her increasing pain was just part of the process. They were hesitant to ask for stronger medication, fearing she wouldn't be alert enough to talk to them. As a result, she was restless, moaning, and unable to find a comfortable position. This was agonizing for everyone. After speaking with a palliative care nurse who explained how carefully pain medication can be titrated to provide relief while maintaining alertness if possible, they agreed to a more aggressive approach. The transformation was remarkable. While not pain-free all the time, her discomfort was significantly reduced. She was calmer, able to hold hands, and even share a few quiet moments of connection. This stark contrast shows that suffering is not mandatory. This understanding empowers both patients and families. Knowing that relief is a possibility opens the door to asking the right questions and advocating for comfort. It means not accepting needless pain as inevitable. Let's move on to the next vital piece of the puzzle. Point 2. The importance of open and honest communication. Effective pain management starts with communication, clear, open, and honest communication between the patient family and the healthcare team. Patients may express pain differently, sometimes not verbally. Families are often the best observers of subtle signs like grimacing, restlessness, or withdrawing. Healthcare professionals need this information, along with the patient's own reports if they can provide them, to understand the nature and severity of the pain. It's not about complaining, it's about providing the care team with the information they need to help. Don't wait for the care team to ask. Bring it up proactively. Think about the difference this makes. I recall a situation where a patient was visibly uncomfortable, but when asked if he was in pain, he'd just nod weakly. His daughter, however, noticed he would tense up specifically when they tried to gently adjust his position in bed. She shared this observation with the nurse. This seemingly small detail allowed the team to understand that movement-related pain was a major issue. They adjusted his medication timing and dosage specifically for repositioning and taught the family techniques to move him more comfortably. This targeted approach, based on the family's keen observation and communication, brought him significant relief during daily care. Openly discussing pain, its location, intensity if possible to gauge, and what makes it better or worse, is the single most powerful tool in ensuring comfort. It transforms the family from passive observers into active partners in care. Point 3. Understanding different pain relief approaches. Pain management isn't a one-size-fits-all approach, and it's certainly not just about medication. A comprehensive pain management plan often involves multiple strategies working together. While opioids are frequently used and highly effective for severe pain at the end of life, other medications like anti-inflammatories, nerve pain medications, or muscle relaxants may also be appropriate depending on the type of pain. Beyond medication, non-pharmacological approaches are invaluable. These can include gentle massage, repositioning for comfort, heat or cold therapy, relaxation techniques, aromatherapy, or simply the comforting presence of a loved one. Let me share a story about a gentleman who found significant relief through a combination approach. He had bone pain, which was managed effectively with medication. However, he also had muscle tension that made him restless. Increasing his pain medication didn't help the tension and made him drowsy. His care team introduced gentle massage therapy focused on his tense areas, combined with soothing music and aromatherapy in the room. This multi-pronged approach addressed the different facets of his discomfort. The medication handled the primary pain, while the non-medication techniques eased his tension and promoted relaxation. He was able to rest more peacefully and was more comfortable when family visited. Understanding that there are multiple tools available allows families and patients to work with the care team to find the best combination for their specific needs. It shows that comfort comes from addressing the whole person. Point 4. Addressing fears about pain medication, especially opioids. One of the most significant barriers to effective pain management is the fear surrounding pain medications, particularly opioids like morphine or fentanyl. Common fears include addiction, which is not a concern when used for comfort and end-of-life care, tolerance, which can be managed by adjusting doses, and the belief that these medications will hasten death. It is crucial to understand that when used appropriately to manage pain at the end of life, these medications relieve suffering without shortening life. In fact, uncontrolled severe pain puts immense stress on the body and can worsen a patient's condition. Relieving that stress can sometimes even lead to a period of improved alertness and quality interaction. I remember a family who were terrified of giving their father morphine, convinced it would finish him off. He was clearly in distress, agitated, and unable to sleep. The hospice nurse spent a long time explaining how morphine works in this context, that the dose would be carefully chosen to match his pain level, that the goal was comfort, and that relieving his pain would actually make him more comfortable and potentially more settled, not less. Reluctantly, they agreed. Within an hour of the first dose, he visibly relaxed. He stopped moaning, his breathing eased, and he finally fell into a peaceful sleep. He had several more days where he was calm, comfortable, and able to interact quietly with his loved ones, something he couldn't do when he was consumed by pain and agitation. His death was peaceful, and the family later expressed immense relief that they had overcome their fear and allowed him that comfort. Dispelling these myths and understanding the true purpose of pain medication and palliative care is absolutely essential. It allows for compassionate choices that prioritize the patient's peace. Point 5. Advocating for the patient. Patients nearing the end of life may not have the strength or clarity to advocate for themselves. This is where families and loved ones play a critical role. Being an advocate means observing the patient closely, asking questions about their comfort level, and communicating any concerns or observed signs of pain to the care team. It means feeling empowered to request a pain assessment, ask about different treatment options, and ensure the pain management plan is being reviewed and adjusted as needed. You have the right to understand the plan and see your loved one comfortable. Consider the situation of a woman whose husband was visibly uncomfortable, but his pain medication seemed insufficient. The family felt hesitant to bother the busy nurses. However, the daughter remembered being told to be her father's voice. She gently but firmly expressed her concern about his pain level, describing the specific signs she was seeing. She asked if the medication could be reviewed or if there were other options. The nurse listened, reassessed the patient, and consulted with the doctor, leading to an adjustment in medication that brought the husband much needed relief. The daughter's advocacy made a direct, positive impact on her father's comfort. Becoming a confident advocate for your loved one ensures their voice, even if silent, is heard, and that their need for comfort is prioritized by the healthcare team. It's an act of love and a vital part of their care. Point 6. Pain management is dynamic and requires ongoing assessment. Pain levels and types can change as a patient's condition evolves. What worked yesterday might not be sufficient today, or new sources of pain might emerge. Therefore, effective pain management requires ongoing assessment and flexibility. The care team should regularly check in on the patient's comfort, and families should continue to observe and report any changes. Don't assume that once a plan is in place, it's set in stone. It's a continuous process of evaluation and adjustment to meet the patient's changing needs. I recall caring for a patient whose initial pain was well controlled. But over a few days, the family noticed he was becoming more restless, even though he wasn't explicitly saying he was in pain. We reassessed and realized he had developed a new type of discomfort related to pressure. By identifying this new source of pain and adding a different type of intervention, specifically targeted medication and pressure relieving strategies, we were able to restore his comfort. This wouldn't have happened if the family hadn't noticed the change and reported it, and if the care team hadn't been prepared to reassess and adjust the plan. Understanding that pain management is a dynamic process means being vigilant, communicating changes, and trusting that the care team will work with you to adapt the plan as needed. It ensures comfort is maintained throughout the final stages. To put these points into action, here are a few practical tips. If the patient can speak, ask them to rate their pain, e.g., 0 to 10 if possible, or describe it aching, sharp, throbbing. If they cannot speak, describe what you see: grimacing, guarding a body part, restlessness, moaning, changes in breathing pattern, withdrawal, inability to get comfortable. Mention what you think makes it better or worse, e.g., movement, lying still. Don't hesitate to ask, is patient's name comfortable right now? What is the plan for pain management? What are the potential side effects? What should I look for as signs of pain or discomfort? Who should I call if I think the pain isn't controlled? Are there non-medication options we can use? Don't underreport pain, thinking you're being strong or not wanting to complain. Don't fear appropriate pain medication. Discuss concerns openly with the team. Don't assume pain is normal or untreatable. Don't rely solely on medication. Explore comfort measures. This video provides general information. Every patient is unique. Always discuss specific concerns and treatment plans with the patient's doctor, palliative care team, or hospice nurse. They are the experts who can tailor the plan. As we've seen, effective pain management is not just a medical task. It's a fundamental act of compassion that profoundly impacts the final journey. It's about ensuring comfort, preserving dignity, and allowing for peaceful moments of connection. It's achievable, and it starts with understanding that pain relief is a priority and open communication is key. Implementing these ideas might seem daunting during an already emotional time, but the steps are often simple: observing, communicating, and asking questions. The effort you put into ensuring comfort for your loved one yields immense rewards in terms of their peace and your own ability to be fully present with them. Ignoring signs of pain or letting fear prevent necessary relief can sadly lead to unnecessary suffering, restless days, sleepless nights, and the inability to fully experience those final precious moments. It can add a layer of distress to an already difficult time for both the patient and the family. I know from experience, both personal and professional, how heartbreaking it is to witness uncontrolled pain when comfort is within reach. But you have the power to make a difference. You have the power to be their voice, to work with the care team, and to choose comfort. It's never too late in the care journey to prioritize pain management and advocate for peacefulness. You have the right to ask for help, and the care team is there to provide it. Choosing comfort is choosing dignity for your loved one. Effective pain management at the end of life is about honoring the individual, respecting their dignity, and ensuring their final days are as peaceful and comfortable as possible. It's about transforming a potentially fearful experience into one focused on love, connection, and peace. It's a cornerstone of quality end of life care that allows the patient to focus on being with loved ones rather than being consumed by pain. After watching this video, what aspect of pain management feels most important to you or your family? Please share your thoughts or any questions you have in the comments section below. Let's continue this important conversation. If you found this information helpful, please give this video a like to help us spread awareness. And if you haven't already, subscribe to the channel for more videos dedicated to sensitive health topics and providing support for difficult journeys. Most importantly, if you know someone who is caring for a loved one at the end of life, or someone who might benefit from understanding that comfort is possible, please share this video with them. This information could make a world of difference in their experience and their loved one's final days. Thank you for watching and for caring about this vital topic. Wishing you and your loved ones peace and comfort. We'll see you in the next video.